Oppositional Defiant Disorder, ODD, symptoms. Causes, treatment, therapy, and cure. Oppositional Defiant Disorder, ODD, is a behavioral disorder commonly diagnosed in children and adolescents. It is characterized by a persistent pattern of angry, irritable mood, argumentative or defiant behavior, and vindictiveness toward authority figures. These behaviors go beyond typical childhood misbehavior and can interfere with social, academic, or family functioning. Symptoms. Children with ODD typically exhibit the following symptoms for at least 6 months. Frequent temper tantrums, excessive arguing with adults, refusal to comply with rules or requests, deliberate attempts to annoy or upset others, blaming others for their mistakes or misbehavior, easily annoyed or angered, spiteful or vindictive behavior. These symptoms are usually more noticeable at home, but may extend to school or social settings. Causes. The exact cause of ODD is unknown, but several contributing factors are recognized. Biological, neurobiological differences in brain chemicals, neurotransmitters, may influence behavior. Genetic. A family history of mental health disorders such as ADHD, mood disorders, or substance abuse may increase risk. Environmental. Harsh or inconsistent parenting, family instability, or exposure to abuse or neglect may trigger or worsen symptoms. Psychological. Children with poor emotional regulation or low frustration. Tolerance may be more prone to developing ODD. Treatment. While there is no single cure for ODD, early and consistent treatment can significantly improve outcomes. The most effective treatments include parent management training, PMT, helps caregivers learn effective strategies to manage a child's behavior. Cognitive. Behavioral therapy, CBT, assists the child in identifying and changing negative thought patterns and behaviors. Social skills training helps children develop better ways to interact with peers and adults. Family therapy improves communication and reduces family conflicts. School-based interventions. Collaboration with educators can help reinforce positive behavior and academic success. Cure and outlook. While ODD is a challenging disorder, it is manageable. Many children outgrow ODD, especially when intervention begins early. Consistency, patience, and a structured environment are key. In some cases, untreated ODD may progress into more severe disorders, such as conduct disorder. With comprehensive therapy, supportive family dynamics, and appropriate interventions, children with ODD can learn to manage their behavior and thrive in social and academic settings. Subscribe, follow, like, comment, and share this post. Thank you for watching.